Hello, I'm Nadia Bilchik, and I'm absolutely delighted to be joined by Drs Bilchik, and Bilchik. Yes, my siblings, Dr. Tanya Bilchik, who is a headache specialist at Yale, Dr. Anton Bilchik, who is a cancer surgeon in Los Angeles, and Dr. Brian Bilchik, who is a cardiologist in Boston. Now, I have brought you many conversations with the Drs Bilchik, and they are back by popular demand. So let's start with you, Tanya. COVID-19 impacted our lives enormously mid-March. It's now nearly the end of September. What are you seeing in your practice, in your world, as a headache specialist in the Connecticut area?
It's an interesting phenomenon. It's actually a new normal. I am very fortunate that all of my patients are coming into the office with masks. Everybody is being really careful. And so I think where I am, people are doing pretty well. They are very cautiously optimistic that we're keeping our numbers down. So instead of seeing most of my patients on video, they're actually coming into the office. They're being careful. And so I think it's a new normal. People aren't traveling, people aren't going on vacation. I think people are working from home and they're becoming more stressed because they are not moving about as much. I'm seeing a lot more neck and shoulder tightness with referred pain to the head. And so I'm seeing more headaches because of that. So that's kind of the new normal in this area.
Thank you, Dr. Tanya Bilchik. And now we have Dr. Anton Bilchik.
So we too are seeing, similar to you, the new normal. Living in Los Angeles, people are very aware of wearing their masks. I think that patients are a lot more comfortable coming into the hospital, are more comfortable having their surgeries, are more comfortable having their cancer operations. One of the big changes is that hospitals have opened up in terms of family members being allowed to visit. It was very lonely during COVID when patients had operations and they were really alone, where the nurses and the doctors essentially became family. But on the other hand, a lot of patients that I'm seeing are just frustrated and are fatigued and want this to be over and are looking for answers and are getting a lot of kind of mixed messages and just don't know who to listen to or where to turn.
That's so true about the mixed messaging. Dr. Brian Bilchik, as a cardiologist, what are you seeing and how do we cope with this influx of so much information, so much contradictory?
Yeah, so it's really a challenging time for all of us. And it's 6 months ago that we had our first discussion about the onset of COVID and what we're going to do. And, I spoke about where did all the heart attacks go and people avoiding seeking care and self-help and taking care of each other and themselves. I just got off a conference call with a physician's council at the hospital where I work. And one of the biggest issues we're talking about is physician wellness and stress. And pre-COVID, the physician burnout rate was somewhere between 35 to 40%. There are some data now that the physician burnout rate is close to 60%. So I think people are all battle weary. I think physicians in particular are exhausted. And we're talking about what are the impacts of COVID. And, just from the personal perspective of the physician, the moral injury of making difficult choices, taking care of patients under abnormal situations, the issues with childcare where childcare centers are only able to have 10 kids at a time. There's a limitation. And then if one kid is ill or has a temperature, they have to go home and the doctor has to go home. And then who's covering the doctor's patients and their clinical care? And then the other component is elder care, where physicians are deemed a threat. You can't go visit your parents because they're more vulnerable, and what are you bringing home, and what are your kids bringing home? And so there's so many tremendous kind of challenges that we're going through. So your question about, as a cardiologist, we're seeing a lot of people who neglected their health over the last 6 months and are paying the price now, and it's a real challenge. We're also seeing an uptick in the numbers, and it's truly heartbreaking to see that all the strategies that really work, including wearing a mask, including washing hands, including distancing, these strategies really work, and why we can't implement that, so we weren't going to the fall and the winter flu season without this potential upsurge and uptick. So most of the country didn't. This is still the first surge. It hasn't really kind of dropped down. I think people are starting to get tired of it and fatigued. And my message to people now is just to stay in the game, be consistent, be conscientious, be compassionate, and really this is not going away quickly.
So it's interesting. The last time we had a conversation, we spoke about all our different levels of comfort, for example, eating in a restaurant. I mean, Tanya, what are your thoughts? Are you telling your patients to, not to? And I know headache is impacted, and you've taught us that about change. What advice and guidance are you giving your patients?
Well, I'll first tell you what I'm doing. We are going out, but we're only going to restaurants where we can eat outside. So, again, it's going to be a difficult situation in New England come winter and come late fall. But we will go to restaurants and we'll go out. We went out last night for dinner, but we were outside. So I think that my advice for my patients is really just to live carefully, be really cognizant about wearing your mask, keeping distant, and not being with too many people if you can avoid it, and keep to your pods. And having said that, I've got one kid who's just moved to Washington, D.C., another one in Boston, and they're young, they're 23, and they and their roommates are being very careful about sticking to individual pods and not going out and partying and things like that. I just had an advisory from Yale. When the kids came into Yale, the new students, they had to quarantine for approximately 2 weeks. Now what's going to happen is the university has advised or strongly recommended that if you travel, Connecticut has a 2-week mandate about if you come back into Connecticut from a higher COVID risk area, that you quarantine for 2 weeks. We've just allowed that change to be tested either before you come back in within 72 hours or when you're back within 72 hours. So again, travel is going to be an issue. So what am I going to tell my patients? Keep your stress level down, try and exercise as much as you can, and try to at least maintain as much social distancing as you can. But stress is a huge thing. And there's burnout, as Brian said, not only burnout with our patients, burnout with your physicians, burnout with your colleagues, burnout with your medical assistants, nurses, etc. It's very complicated.
Anton, by the time patients come to you, it's usually for cancer surgery, pancreatic, colon, that is right. So often they don't have a choice.
Yeah, they don't. But if I could just comment on the mental health aspect, I think what is really important for people to know is that the brain controls every part of your body. So the connection between your brain and stomach pain, brain and cardiac health, brain, and so this whole concept of trying to reduce stress and mindfulness, I think not only is important for the brain, but is important for disease and also cancer prevention. I think that several months ago, we were led to believe, for example, that you can't touch surfaces. We didn't know if you took your car to a restaurant or anywhere else, and someone valeted your car, does that mean that you couldn't touch your steering wheel? If you went shopping to a grocery store and you saw someone, touch a container, does that mean you could? And I think we've come a long way since then. Learning that's highly unlikely that you're going to pick up COVID from someone that may have touched a surface somewhere, and that in itself is really a big deal. So I think that going out is really important. in Los Angeles, the restaurants are all outside. It's still warm. It's still summer. I actually hope that the restaurants continue to have outdoor seating even post-COVID, because it's created this kind of European atmosphere in Los Angeles, and that really allows for a better atmosphere and for people to feel a little bit more normal. As far
so
as
you're saying it's not a myth that outdoor participation, outdoor eating is healthier?
Correct. It's safe, and I think that
safer.
I mean, the restaurants are very careful to distance tables. I think again, people are very aware of not only distancing but wearing masks. It's a little bit difficult to eat with your mask on, but that aside,
although I think Brian managed it once, right?
Yeah, I think but to get back to your question about colon cancer, pancreas cancer, I mean, we are seeing an epidemic of young people with colon cancer under age 50. It's gone up 5 to 6-fold. We really don't know why, and there is real concern that similar to cardiac health, that people just are not going to get screened early enough, and we're going to start seeing an even higher incidence of colon cancer. Pancreas cancer is a little bit more tricky because it's a more difficult diagnosis to make. Clearly, with the death of Ruth Bader Ginsburg, we're talking about pancreas cancer a lot more than we did previously. I find the RBG story really quite remarkable.
You were not that surprised. I mean, she was 87 after all.
She was not only 87, but she's been dealing with a cancer that typically people don't survive more than 12 to 18 months. And she's been living with it for years, and has continued to function. And she's really had pancreas cancer that has spread for several months. So really no surprise. And I think she far outlived the diagnosis and the disease. I think we all would have liked her to just continue to fight this cancer and live many more years. But pancreas cancer in general is just a devastating cancer, and relatively little progress has been made in curing patients. So she way outlived what you normally would expect.
But I think what you're all saying is, if you feel ill, go and see the doctor. The danger of not going is greater. And that's what I'm hearing from all of you. Just for full disclosure, the person who really watches me interviewing the doctors Bilchik, and who really gives us a lot of feedback is our mother. And our mother sometimes says we go on too long. So I'm going to keep it short, both for you, our audience, and for our darling mother, Nadia Bilchik, in Johannesburg, South Africa. But before we end, and this time, Brian, I'll start with you. This is a final closing. We have an opportunity here. We're talking to a lot of people in my various communities and yours. Final words as we navigate, as Tanya put it, this new normal. And then I'll go to Anton, and then I'll end with Tanya.
Yeah, so it's very, it's been quite a evolution over the last 6 months. I would say we've learned so much about the virus, how it's spread, what we can and cannot do. Surface to surface spread's not so much an issue, but we do know the air droplets and dispersion. So when you talk about healthy buildings and air exchange, and I'm learning all about the mechanics and the engineering of that, a good building will have air exchange every 6 times an hour. If you're outside, you're exchanging air much quicker. And so as long as there's dispersion and you're not on top of someone, if you're eating, you can't eat with a mask. And if you're too close, even if you're outside for more than 10 to 15 minutes, you are likely, even asymptomatic spread occurs in that way. I just want to end it on one thing, because I didn't get a chance on the last point, was one of the interesting things from a cardiac perspective that we're seeing and we're having to address is what happens to our athletes who are have recovered from COVID, and there's a high incidence of myocarditis and heart inflammation and heart muscle dysfunction. And when you look at these athletes, when is the right time for them to get back to sport or to participate, even if they've recovered from the virus? So we know that there's lingering long-term aspects of coronavirus. So the death is something we focus in on. There's a lot of people who have coronavirus. Most people, 95%, 98%, have absolutely no problem, just a mild viral illness and no problem. But there are many people who have lingering, sustained, chronic issues related to this. If you can avoid getting it, avoid getting it.
Thank you, Brian. And now up to Anton.
Yes, I'm not as smart as Brian, and I don't know much about mechanical and aerospace engineering, but I do like to eat. And I would just go with what Wolfgang Puck says, which is you need to live, love, and eat. And try and live as normal a life as possible under these circumstances, knowing that it is not going away soon.
We need to talk more about it not going away soon, but I'll keep that for this time next week. Tanya.
Stay safe, be healthy, wear a mask, and keep your social contacts as limited as you possibly can. But don't forget to go and see your healthcare provider, because don't leave things too late.
A special thank you to my siblings, Drs Bilchik, and Bilchik, for joining me in these live broadcasts. And first of all, to all three of them, I hope I get to see you in person soon. I hope we get to see our mother in Johannesburg, South Africa soon. And I'll leave with Anton, let's love, let's laugh, and let's live. But as Brian says, let's do it carefully. And as Tanya says, let's navigate the new normal. I'm Nadia Bilchik. Thank you for joining us.